Hi, I'm gonna tilt my camera. Sorry. My name is Keisha Williams. This is my daughter Serena Williams. We'll be doing the video today on turning a patient. So she's gonna be my lovely assistant. So I've already done my hand hygiene. That's the first thing you wanna do when you enter the patient's room. You wanna go ahead and wash your hands so that they could see that you're actually cleaning your hands before you work with them. You wanna make sure that if you're using sanitizer that you get that hand sanitizer when you enter their room and not outside of their room. And if gloves is necessary, you use gloves. For turning a patient, I would definitely use gloves just because you never know what kind of fluid or anything that comes off of the body that you may encounter. So I would use gloves in this scenario. So when I enter her room and I do my hand hygiene, I will tell her who I am, have her identify who she is, and I will tell her the reason why I am in her room. So we're just gonna say that maybe she's paraplegic on her lower body. So we'll just go with that scenario for turning the patient. So I'll tell her, my name is Nurse Casey. I'll be your nurse today. I'm just here to help turn you over and do some clean you down. Could I just have you verify your full name and your date of birth for me?
My name is Serena Williams. My date of birth is December 21st, 2011.
Thank you. And then I will check her wristband just to make sure that she is who she says she is. And then I will also look at her wristband for any allergies. And I will also ask her if she has any allergies. Do you have any drug allergies?
No, I don't have any allergies.
Awesome. So have you changed you before? You know what to expect. We're just going to be maneuvering you around a little bit so we could get your front area clean as well as your back area. And that's pretty much what we're doing today. So just a little brief description of what we're doing today. So when you're turning a patient in bed, the whole reason why you're turning a patient in bed is because you want to help keep the blood flowing. We want to prevent any risk for, blood clot or anything. So we're just gonna we're turning them over for one, so we can help keep the blood flowing. The second reason why is because we want to prevent pressure ulcers, or we want to prevent the risk for pressure ulcers. If the patient already has a pressure ulcer, you need to be inspecting that pressure ulcer and ensuring that it's not getting worse. We don't want it to get worse. We want it to get better and not worse. But if they have no pressure ulcer, there's the risk for pressure ulcer. So we want to make sure that we're turning them in bed every hour to 2 hours. We want to check the skin also when we're turning them over. We want to make sure that there's no redness or no sores. So if they don't have any pressure ulcers, then we want to make sure that they're not developing a pressure ulcer. Like sometimes you'll see them with a red spot in that pressure ulcer in that area. So then we could tell, okay, the patient seems to be developing a pressure ulcer. We don't want that to go any further. So maybe let's change them every hour, turn them every hour instead of every 2 hours, and keep an eye on that pressure ulcer. So turning them does help us to inspect the skin and be aware of anything that may be occurring with the skin. Then it just helps maintain muscle mass and tissue integrity in general. So we're maintaining that muscle mass and that tissue integrity and just keeping things going and doing it because the patient is not able to do it for themselves. So we will turn them over, like I said, every hour to 2 hour, and you turn them over using a draw sheet. And it's just a sheet that you put under them. Now some people will put a draw sheet under them every time they go in there to turn them. But if the patient is bedridden, it makes more sense just to have a draw sheet under them so that you don't always have to push that draw sheet in and take it out and do it every time you turn them, because that could be an annoyance for the patient. So we want to make it as easy and as simple as possible for the patient and for ourselves as well. Now, when I say push it over, like say if she did not have, turn the camera down. So say she did not have this draw sheet under her. Most people, and you want to do this with two people, not just one. It's better to be safe than sorry. And whereas maybe some people feel like they could do it on themselves, it's the risk. There's just too many risks. So two people is better than one. So if she didn't have this towel under her, let's pretend this is one. I would have my partner on the other end. I would be on this end. And what I would do is I would take this blanket and push it under her up until I can't push anymore. Hence why you need gloves, because you don't know what you may come in contact with. So I would just push this all the way, and then my partner would use the draw sheet. Well, at that point she wouldn't even have the draw sheet, so she would push I would roll her over, and then she would pull that sheet underneath my patient, and then she would have the drawer sheet under her. But for this video, I already put the drawer sheet under her, so we don't have to worry about inserting a new drawer sheet under her. And most places that I've done home health in, we always have a drawer sheet already under the patient. Unless if it's dirty, then we switch it out and then we put a clean one, but we always have that drawer sheet under them. Just like with the Hoyer lift, that, what's it called? The sheet for the Hoyer lift to lift them up, we also always had those under the patient, so that it was just, we were not always yanking under there, and we just always had it readily available under there. So she does have the drawer sheet under her. So if we were cleaning her, but this is just a turning video, so I'll just give the scenario anyway. If we were cleaning her, we would get her undressed, and usually you do, everybody's different, but I usually do one at a time. So I'll take the top part out to the front of the chest, then we would use the drawer sheet. I would use the drawer sheet and lift her up this way. My partner will hold her up that way, and then I would clean her back. I will dry her down too, because when you wash, you want to dry. And then we would gently roll her back down. Then my partner would use her drawer side of the drawer sheet, roll her over this way, and then I would hold her in this position. My partner will clean that other side of the back, just to make sure that we're getting all areas. At that point too, we're also inspecting the skin, making sure there's no breakdown or anything unusual. You just want to be aware of anything that may be going on. So when you're cleaning them, you're observing, you're inspecting, you're just looking, you're touching, just everything. Then I will lay her back down. Then we will put her shirt back on, a clean shirt back on. So we will clean the upper body, put a deodorant on, her lotion on, and then put a new shirt back on her. Then we will take off the second half, clean the below, the front of the body. Once that's done, dry it up, and then flip her the same way, with the drawer sheet. My partner would be holding her at this point, because I'm flipping her to the side my partner is on, so she could hold her, so I could clean those areas. Then we gently roll her back down, and legs straight. Keep the whole body straight. When you're doing this, you want her whole body flat and straight. So let's get off of this. If they have a pillow, you would usually remove the pillow, because you just want to keep everything in a supine position. So then she would be rolled back over to me, with the drawer sheet. My partner will clean her up, then we would gently place her down. So that's just the whole turning the patient in the bed position that we do. And for individuals like paraplegic, stroke patients, and it always depends on the patient, what they have, and the situation with the patient. But for patients like stroke patients, you want to lay them down on the unaffected side. So if they had a stroke on the right side, you'd want to lay them down on that left side. And based on the severity of the stroke, you could have them in a chair with, what's it called? Oh my gosh. I'm trying to remember the name. Oh, hold on. Armchair. You could place the patient in an armchair in that upward position, so that they're sitting, so that too could help them with their breathing, because we don't know how the airway may be affected, so we kind of want to pay attention to that. So having them sit in an armchair, having them sit in a wheelchair, having them in a Fowler or semi-Fowler's position too, that may be able to help them, and those may be safe for patients with strokes. But if they're laying down, you want to lay them down on that side that is not affected. And you also want to be doing the same thing with them, turning them over every hour to 2 hours. You want to have that drawer sheet for them as well. It's just better to have the drawer sheet. So that's what we would do with stroke patients. But that is all I have for you guys on turning a patient. Thank you for watching.